contracts. What to know before you sign. I'm Linda K. Tyler, Director of Business Development for ASDA, and we are glad you have joined us as we have an informative and interactive presentation planned for you this evening. During the presentation, we encourage you to ask questions via the Q&A feature, which is located at the bottom of your screen. Please click on the Q&A button and you can submit your questions. I would like to take this time to thank Heartland Dental for sponsoring tonight's webinar. I would now like to introduce our presenters, Brittany Bales and Dr. Joe Ajala. Brittany Bales is a Heartland Dental doctor recruiter, bringing over 10 years of experience across both operations and recruiting. Her background spans multiple roles, giving her a strong understanding of both the clinical and business sides of dentistry. Brittany is passionate about supporting doctors as they begin and grow their careers and focuses on helping individuals build strong, long-term, fulfilling paths through meaningful partnerships and guidance. And Dr. Ajala earned his Doctor of Dental Medicine degree from Tufts University School of Dental Medicine and has completed advanced training in implant dentistry, Invisalign, and communication. He is an active member of the American Dental Association, and as a Heartland Dental supported doctor, Dr. Ajala is dedicated to delivering patient-centered care rooted in respect, compassion, and education. He partners with patients to help them understand their oral health and make informed decisions to support long-term wellness. It is my pleasure to introduce to you Brittany and Dr. Ajala.
Awesome. Thank you so much, Linda. We are super excited to be here tonight. Dr. Ajala and I have partnered for quite a while now, and so excited to do so in this capacity. And so we are going to go ahead and get started. So with dental contracts and what to know. So our goal for today is to make sure that you guys understand what to look for in a dental contract beyond just compensation. We know you guys are finishing up school, and I'm sure that student loans are weighing heavy on your mind, or maybe you're just getting started, and I'm sure that that is already something of a focus, but we want to make sure that you guys are looking big picture and that you know exactly what questions to ask to make sure that you're finding the right fit for you right out of school. With that being said, we want to take a look at not only the compensation, but also your contract terms, benefits, practice expectations, and then also help you guys to gain confidence in asking questions and learning how to better navigate contract discussions overall. So we're going to kick things off with a poll. And we want to know, what are your plans after dental school? Do you plan on joining private practice? Are you leaning towards a DSO, potential residency, straight into ownership, or maybe not sure, or something else entirely? So we'll give you guys a couple minutes if you guys will just log in. What are your plans after dental school? So exciting for us. It looks like a large majority of you guys are looking at a DSO. Hopefully you'll consider us, but regardless of who you go with, we hope that today helps you guys to kind of maybe map out, for those of you, the 27% that aren't sure. Hopefully this will give you guys some additional resources to be able to better help make that decision. Second, let's see. So sorry, I have a second poll question. So when you guys are getting a contract offer, what's the first thing that you're looking at? Is it compensation and your earning potential, benefits and PTO, the schedule and your work-life balance, mentorship and clinical support, overall contract terms, or growth opportunities and kind of what it's going to look like long term? Awesome. Yep. So compensation and earning potential. So no surprise there. We know that is super important, especially as you guys are getting out. So hopefully, even if that remains your number one thing after we jump off this webinar, we can arm you guys with some great questions to ask as you are navigating those contracts. So a little bit about us. I know we got some fabulous intros at the beginning of this call, but I'm Brittany Bales. I am one of our regional doctor recruiters. I currently support the Central Orlando and Tampa markets, as well as Tennessee, Kentucky, Indiana, a little bit of that area. So I have been with Heartland going on 13 years now. And like they mentioned, supported in the field. I actually got the opportunity to support Dr. Ajala as an operations partner and then moved into doctor recruiting. So now I get to support people like you guys every day within the way our recruiting structure works. I am typically one of your first points of contacts, and then who I would consider both an advocate and a partner as you guys are making your way through the interview process, basically advocating for what you're looking for with my ops partners, and then also trying to make sure that what you're looking for is matched with the office that we decide on for you as well. So I'll let Dr. Ajala also kind of intro himself because he's got a great history with us.
Right. So, like Brittany said, and everybody said, I'm Dr. Jala. I finished dental school at Tufts University in 2001. Between 2001 and 2006, I had actually gone from practice to practice to practice till I eventually found Heartland. So, I've been with Heartland 20 years, and I am the regional doctor mentor for the DFW region. And like Brittany said, we worked together for quite some time. And I think Brittany working one-on-one with the doctors and being on the recruiting side now, I think it's a good combination of a mentoring that she has to be able to help anyone that is considering thinking about coming into Heartland. That said, with Heartland, I've grown immensely. And from what I see with you guys when it comes to compensation, it's you will be the architect of your how your compensation goes, but without much ado, we welcome everybody and thank you.
So thanks. So our goal with today's call is a couple of things. So the first and foremost being why your contract is not just about money. Money is a huge factor in it, but you can also negotiate a very high compensation package. And without looking through all the individual details, you may set yourself up for a situation where you're locked in to something that maybe is not preferable or is a short-term fix. So we want to help you guys to learn what to look for specifically in a contract, and then also figure out how to approach conversations in a way that set you up for success, to request changes, be confident about the things that are non-negotiables for you. We know that you won't get everything necessarily. Some of you might in a contract, but we want you guys to really be able to advocate for yourself and ask the great questions to get the things that are most important to you guys. So congratulations. You've officially been offered a contract. This is probably one of the most exciting parts of my job. And I'm sure Dr. Jala, having been on the other side at one point receiving his contract, it was a very exciting day in his career. It feels nice to be chosen. It feels nice to feel like you beat out all the other people. But we really want to figure out, okay, what's next? What do I do with this contract? And for most of you, especially after that poll question, we know it's probably going to be one, to get excited, and then two, to quickly look at what the compensation offer is. So we know that you guys are going to jump to that, but we want to also make sure that you guys take a minute to take a breath, slow it down, because you can immediately be excited or maybe a little bit deflated about the number that was reflected on that offer. And so by slowing down, we're actually going to break down a contract essentially into 4 different components to help you really assess big picture, the offer that you received, and figure out how to approach it into multiple different components to help you guys better decide, is this the right offer for me? So those four different components that we're going to talk about are one, how exactly are you going to get paid? Um, the second being what benefits are included. The third, a little bit more operationally focused, but how is the practice managed? And number four is what happens when it's all over. When the contract ends, what happens? So we are going to start off with compensation. So there are a lot of specific questions here, and there's a lot of positives as well as drawbacks when it comes to any of these different scenarios. So the first component is production versus collections. So a couple of things that we want to note with this is, so obviously most, I would say, doctors that I talk with immediately think production might be the more fruitful of the two. But there's a lot of good questions in terms of how are or who makes decisions regarding adjustments. So production is procedures, the work you actually do. So this is what is charged out. This can be changed via your own adjustment, but whether you want to give maybe a patient a discount. It could also be changed by somebody in the practice. And the numbers that are charged out are typically associated with a fee. So a patient's insurance, or if they're a cash patient, whatever your office fees are. So it would be good to know on the front end what those fees are, what is going to be charged out. And then on the flip side, if you're looking at a collections-based model, what are the collection systems in the practice? How are you ensuring that everything that's being done is being collected? It's important to know the collection rate and what procedures will be allocated towards your provider ID versus somebody else or versus the other providers that may be in your practice. The second part is there any kind of salary? So with a salary, whether it's a daily guarantee or an annual guarantee, is there any sense of stability or guarantee with the offer? Or is it strictly just based off of a percentage of your production or collections? And is any of it guaranteed for just a specific amount of time? So in some agreements, salaries or daily rates may fluctuate. Sometimes they're guaranteed for a specific amount of time, and then they may change. Or they may be for the life of your contract. So it's important to know, what am I guaranteed and for how long? And is it just a percentage, or is it just a salary or combination of both? With that being said, it's also important to understand any terms related to payback, drawback, or any kind of stipulations like that. So things that may be deducted from your paycheck as a result of not meeting certain goals, whether it is payback in terms of any initial bonuses that are paid out. What are the terms of those payback or to be paid back in the event that maybe you don't meet the terms of the contract or leave outside of your contract? Any of those specific stipulations, again, regarding about how your pay may be manipulated or changed in different situations. And then lastly, finding out whether you'll be classified as a W-2 employee or a 1099. There can be pros and cons here. A lot of people would say that a W-2 allots you a lot of benefits because typically then you are able to get medical, vision, all of the different benefits that a company may offer. And the company is typically paying a portion of that versus a 1099 where you're typically not going to be eligible for those benefits, resulting in you having to pay that entire amount out of pocket for you to have that kind of coverage, which would then be seen potentially as a reduction in your overall pay, since that's an additional expense to you personally. However, a 1099 may give you some more flexibility if that's something that you're looking for. Typically, as a formal employee on most contracts, you're going to be contracted for a specific period of time, whereas a 1099 may allow you to kind of come and go as you want, but also as your employer may want. So they may sign you for a certain period of time, and then they have a lot of flexibility to adjust that time as they see fit too. So it's not necessarily, it could be seen as a win on your side, but also knowing that your employer potentially has that same flexibility with your employment as well. With that being said, before we jump to the next one, any initial questions or clarifications on the compensation piece of things? Awesome. And you guys feel free to throw questions in the chat if you have them along the
Mhm.
way or if they come to mind on later slides.
So,
So
Brit, one, the with regards compensation, with regards contracts and all that, I think it is important for the doctor to understand how transparent the DSO is. Do you have accessibility to the P&L? You know, do you have who does the adjustments? Because all this will affect the compensation, you know?
yeah,
So,
and that's a great thing to ask if you guys are doing site visits in addition to or as part of your interview process, whether it's with us or with a private practice. Those are great questions to ask, but also to see for transparency. Can you see the fees that are being charged out at the office?
mhm.
Can you see a P&L? Can you see adjustment reports? Um, it's very telling how transparent a office company doctor may be. But also too, it's important to know on the front end kind of the current health of that practice. So the second component we are going to touch on is oops, the end of contract terms. So with the end of contract terms, this is a couple of different things. So first, what is the length of the contract and what is the renewal process? So will there be a formal sit down where you can renegotiate things? Is everything negotiated on the front end and can't be changed down the line? At the end of the contract, does it end? And we have to evaluate whether or not you're invited to stay on or will it automatically renew? So you want to know what's going to happen when you hit the initial or end term for your contract. Second would be what the termination notice is. So if you are looking to leave your employment with that company or that group, what does it look like? Are they requesting a certain period of time? If you don't meet that certain notice period, then do you face any sort of penalties? We want to know what does it take in the event that I decide this is not for me to be able to leave. And then additionally, from a restricted covenant, what this means is for whatever amount of time following your employment or the end of your employment, is there kind of any restrictive mileage or distance from that practice that you cannot practice or solicit patients or employees, things like that, following the end of your employment? We want to know so that if you do move on from the job that you're in, are you going to potentially have to relocate to get outside of that restrictive mileage? Or is that something that's negotiable? So that would be something else that we would encourage you guys to look at. And that kind of goes hand in hand with that non-compete and non-solicitation. I saw, so one of the questions in the chat explaining what you mean when you say adjustments. So adjustments are essentially kind of like write-offs. So if a crown cost $1,000 and the doctor or the office manager or whoever wants to give a $200 discount, that would be considered like a $200 adjustment. Or if, say, for example, the wrong set of fees were charged out, that we may have to make an adjustment. So maybe you were able to charge out $1,200 for a crown, but oops, they had insurance and we actually were only supposed to charge out $800. That would drop and make your production $800 because of the adjustment versus $1,200. So that clarifies. With regards to common mistakes to avoid as it relates to a contract ending, I guess questions there, I guess just to clarify with that, is this when you're ending the contract maybe, or if an employer is ending a contract? The only thing that initially comes to mind is, how you're getting paid during that notice period. Some different organizations will change your pay structure for that last 60 days, the last 90 days. And sometimes it's not in your favor. So I think just asking those questions of if anything is going to change in terms of how you're paid during that time. And then what happens maybe to any residual collections or production or whatever that's after you leave. But then also making sure if they, I think just talking through things like if you give notice somewhere, can they let you go immediately would maybe be something, or if there's terms where they have to keep you on for that time, or what happens if they find your replacement. Those would maybe be some questions that I would ask. Do adjustments happen all the time in most of offices, or is it something that happens only sometimes? I would say it happens pretty frequently, some offices more than others. And Dr. Ajala, you can chime in because you've been in a few offices, but usually it's related to, I would say, some training issues, sometimes with
Hmm.
the staff. Um, I would say that's probably the most common error, or even people maybe taking liberties with giving adjustments to maybe get treatment to close would be another common reason to adjust.
Right. So, and also this is where transparency comes in. You know, who, if there's going to be adjustment, is doctor going to be aware of the adjustment? Or are you just going to say, oh, I produced 100,000 last month and voila, it dropped to 80,000? You know, production, and you're expecting a certain amount of production. And adjustments will happen, you know? So, I mean, there is patients show up with insurance, patients don't have insurance and secondary insurance. So, but the key thing is the DSO, are they transparent? Is the office transparent? Are you aware who's in control of the
Mhm.
adjustments?
Yeah. Or even in the instance where maybe a patient doesn't pay day of service and it's been 90 days and they still haven't paid their portion. Maybe there's a $200 balance. Who makes the judgment call with what happens to that
Hmm.
$200? Is it sent to collections to try to be collected? Is the doctor able to make that decision, or is the office manager making that decision? Um, and just again, like Dr. Ajala said, can you see an adjustment sheet? Will they give you an
Hmm.
adjustment sheet at the end of the day where you can see what was adjusted off, where it gives you the opportunity to ask questions, to get the why, and to give any feedback to your team in instances like that.
Right. And before adjustments are made, are you being told
Mhm.
before?
Awesome. So next up, we are going to also talk about additional support to consider. So these would maybe questions that you want to ask about the practice specifically, once you get to the point of narrowing down to an office. So the first would be patient volume. So looking at, can they support as a practice if you're the second doctor, if you're the third doctor, or even if you're a solo doctor, if that's the route you go straight away out of school, what is that volume going to look like? And again, how much control and say so do you have in the volume that you're seeing? I know that I talk with a lot of new grads who are very concerned with how many columns they're going to be running, how much time they get for procedures. We know that that's important to you guys to get your speed going, and for that to be a focus your first year. So are you the one making the decision in terms of how many patients that you're seeing per day? How many columns that you're running? What does that look like? So it's both a, what will my schedule look like day to day, but also, can you support me so I can hit my schedule and clinical goals? Um, in a multi-doctor practice, the responsibilities. So one thing I think is important is there any kind of hierarchy? So like, is there an owner doctor? Is there a lead doctor? Is there a are you considered an associate where people are going to maybe dictate what treatment you get to do or don't get to do? Um, will you have an even split of patients, or will be somebody be adjusting and making those decisions for you guys? And then with your support staff, what are their responsibilities? So um, it may be important for you to know in the state specific, are you going to have EDAs who will be able to help you? Will you have hygienists that are able to numb in the states that they can do that? If you have operational support, what does their role entail and how can they support you? If you have an office manager, um, what are the expectations of a person in that role? With continuing education, is there anything offered? If it is offered, who is paying for it? Are there any like CE allowances? So are you allowed a certain amount per year? Is a certain amount covered and then it becomes your responsibility? One thing I think that's important is figuring out if there are any prerequisites or requirements in order to get into specific CE that you're looking for. I know implants is a big one, and I've heard everything. I mean, we have kind of our own requirements as well, but I have also heard things in terms of having to um, be with the company a certain amount of time, having to produce a certain amount, having to have certain levels of profitability. So it's good to know those things on the front end because maybe they're paying for it, but maybe they're paying for it once you achieve certain markers. And then lastly, the cost of your labs and supplies. So who is responsible for those fees? What are those fees? What flexibility do you have to use supplies and labs that are maybe outside of the ones that they designate? Are you allowed to? And then also to who is responsible for remakes, redos, those kinds of costs. And again, asking if you are responsible for those fees, asking to see what those fees are. So it's good to have transparency there as well.
I also think that when it comes to multi-doctor practices, it is essential for the incoming doctor when you go in, make sure you talk to the doctor that is there.
Mhm.
It is essential that we and be on open and honest, ask questions. Okay, I'm comfortable doing this. Can I rely on you for this? And get their commitment as well. Because if you're going to be there 8 hours a day, 4 days a week, you might as well know a little bit more about the doctor that you potentially will work with.
And kind of touching on the question in the chat, because it kind of goes in alignment with that. When you say owner doctor, you're referring to a newly affiliated senior doctor. So typically owner doctors, so in private practice, that would be an owner doctor. So somebody who actually owns the business. But also in certain DSO models, they can have an owner doctor, and those owner doctors can and do dictate specifically what I hear often is what specialty type procedures doctors can do. So if they have maybe a specialist that comes in, they may be paying that specialist regardless of whether there's production on the books or not. So there's a lot of times where they want to make sure that if they're paying somebody that that doctor's coming in and doing work. So they may say, hey, their schedule's empty. I see that you have extraction of thirds on your schedule. We need to move that over to the specialist so they have something to do when they come here, and you may not get the opportunity to do that procedure. Or, unfortunately, I've heard of owner doctors who will take bigger production appointments, maybe leaving a newer grad to do hygiene checks, restorative, like fillings, things like that. So it's really just figuring out like how much autonomy that you have. And if there is a more senior doctor on site, really what is their role and like when can they dictate what treatment you diagnose. With regards to an acceptable adjustment or loss margin, Dr. Ajala, any feedback from you on like, and what would be your acceptable adjustment or?
So I saw that question. The acceptable for me is zero. you know but sometimes in life it's the more you adjust, the more you be in tune with your office and see what is going on you know and over time you get more accustomed to the roles of the BAs, that is the assistants, the business assistants you know so 5-10% is acceptable. I don't know what the Britain will probably know what the average is out there. I don't.
Yeah, I think it can vary. I don't know that we necessarily have a like a Thrive number or anything like that, but I would say
Mhm.
probably 10% or less.
Yeah. Mhm.
Um, so who decides if an adjustment is made? Can we decide no adjustments or no discuss? So that's again a question for you. I know specifically in Heartland, we are doctor led, so doctors make those decisions, but that may be something that may not be the case. You may be in a situation where maybe that's the office manager's discretion, maybe that's the owner doctor's discretion. So that would just really be a question to ask is who gets to make those decisions. Um, and if they say it's doctor led and you get to make those decisions, I would ask, okay, well, then is it possible for me to see a day sheet, is what we call it, which will detail out any of those adjustments. Um, and they could provide them for the current, I mean, they should be able to provide them for the current doctors as well if you wanted to see an example of what the adjustments are like for the current providers.
So, Brittany, is there a situation whereby, whether we like it or not, there has to be adjustments for maybe like insurance company, maybe, oh,
Yeah.
yeah.
Yeah, so there will be situations. So, like a good example is a patient comes in and we charge out full fees, and maybe they come back after the fact and say, "Oh, I didn't realize we had dental insurance." And so then we've got to make adjustments because we have to charge out those fees per the insurance. So there's things, and that's where I go more into like the training. Sometimes it's a training issue where your team just doesn't realize. Or maybe there's new business team members. So then that's really where it's great to maybe ask. Whoever you're interviewing with, like what is the tenure of the team? If there are new team members, what does their training and onboarding look like? Are they being trained on how to verify insurance? Are they trained on how to run reports? Things like that. You can kind of go that route. If the team is more tenured or maybe they have a newer team, I would dig more into like what does the training look like for your business team?
And also, I know that AI is getting involved in insurance company. I know Heartland has, I think we're rolling that out
I think by the end of the
June.
year.
Yeah, yeah.
So that'll help close the gaps too.
Hmm.
And that's another great question to ask. Like, where are you guys at in terms of technology and
Yeah.
um, anything that you've integrated to help close the gap on mistakes when it comes to verifications of insurance and payments? Yes. So our personal compensation for the question in the chat, the first two initial pillars are that you have a guaranteed annual base salary. And then you have the opportunity to bonus monthly. And when you do bonus, it is 25% of your personal collections.
And
Um,
the
sorry, go ahead.
I was going to say, and the 25% over time with things like hygiene bonus and some other structure, it bumps up
Hmm.
to an average of about 32
Yep.
of collection.
Hmm.
So yeah, there are more details on as with regards to that.
Yeah. And that's a good point too that I missed earlier on just compensation in general. A great question when you're being paid a percentage of production or collections is to ask. So if they say 30%, whatever the percentage may be, my next question would be of what? So am I getting 30% of all procedures that I do? Are there specialists on site where I'm getting 30% of simply restorative and I won't be able to do any endo, any ortho, any oral surgery? And then also when you take into consideration the of what question, of what, and then also as we're getting into benefits and touching on the lab fees and supplies, additionally, what's taken out. So you may get 30%, but it may be 30% of just restorative dentistry because you'll have specialty on site. And then when you also deduct your lab fees, when you compare that to a model that is maybe it's like ours where it's 25%, but you're doing all procedures and you're able to function like a super GP and there's no cap to your earning potential and nothing like labs, supplies, CE are being deducted, that doctor may actually end up out earning the doctor in example, the first example. So is production split with hygiene? So good question. Typically, no. In our model, it's not. So each clinical provider has their own provider ID in the practice. So like a prophy, if a hygiene does it, would go to the hygienist. A crown, when the doctor does it, would go to the doctor provider ID. So it's sometimes important to know that. I don't, just to be for sure. I think the only place that it might get dicey is sometimes people ask a lot about x-rays. That's a common who gets the
Hmm.
x-rays. But otherwise, anything done by the doctor in the doctor's chair goes to the doctor, and then same for hygiene. Lab fees. So with us, it is an office expense. So doctors do not incur the lab fees ever, whether it's Invisalign, redos, remakes, anything like that. But that's not always the case. Those are sometimes in private practice or other DSO models, sometimes a doctor expense. Awesome. So the next component that we wanted to touch on, oops, are additional benefits. So this is really what else you're getting in addition to um, your compensation and all of that. So things like your typical health, dental, vision, life insurance, disability, malpractice. So not just malpractice, but who's covering or paying for the malpractice insurance, vacation, sick leave, maternity leave, and then also like those long-term wealth building. So retirement plans, ownership, equity options, things like that. Kind of figuring out like what am I taking advantage of big picture? Um, so the question in the chat, what are some things on a new grad resume that increase compensation offers? That's a great question. I will be totally transparent that, and we are big on this. We have all the resources in the world. We have incredible mentors like Dr. Ajala. We've got incredible CE. We want good people. We want people who are eager to learn, who take initiative, who want to be leaders in their practice. We can teach you guys the rest. It's great if you've had a great clinical program, but honestly, we're after who the person is. So the more that you can show up on those interviews and share examples of opportunities where you've taken leadership, taken initiative, whether it's through ASDA, whether it's through sports, whether it's within your family structure, in another job, things like that, that will stand out. We hire people all the time with less than experience than other candidates because their personality was amazing. And we can't change your personality. We can help you with your leadership, we can grow you clinically. But those aspects of a person, that's what we're personally really after. An example of equity would be like for us, we offer the opportunity to invest in stock in Heartland Dental. So you become a shareholder in Heartland Dental. So that would be an example of equity. In the case of x-rays made by the hygienist, is it the doctor who will interpret and diagnose them? Who are these x-rays? So in a new patient appointment in our structure, if a hygienist takes the x-rays, the hygienist will get credit for the x-rays, but the doctor is the only one who can diagnose. So you'll still diagnose, you still make those determinations. They'll preheat for you and maybe give you an idea of where they're seeing areas of concern, but you are the one to diagnose. But because they physically took the x-rays, they are the ones who are that's going to be credited towards. Now, on the flip side, if your assistant is seeing a limited patient for an emergency and they take an x-ray of that tooth, that suspicious area, that will go towards the doctor's provider ID. Do you guys take dentists who already have going to resident? Yes, because one, we know that that's not for certain. I will be totally honest. We hire a lot of doctors with the anticipation that they want to maybe pursue a residency. And then they find that what they were looking for in a residency, they get with us with the hands-on experience, the courses, the mentorship, because our courses are not just, and this maybe not even just speaking for us, but there are some companies that with the CE that they offer and the workshops and the mentorship and things like that, they kind of get what they were looking for in a residency and then they decide not to go. So that's never a disqualifier in bringing somebody on. Candidates with years of international clinical experience.
Hold my beer on that, Brittany. Hold my
I
yeah. Go on.
No, go ahead. Go ahead.
The answer is yes.
Yes. We
So
love international doctors.
yeah, we do. I finished from Nigeria, did a few years in Nigeria, then I went to England, did a few years in England, then I went to Boston, did a few years in Boston. So the answer is yes.
Yes. We love international doctors. We recognize there's going to be differences in how you guys practice,
Mm-hmm.
but we definitely take that into account and it's definitely not a negative. We usually see that as definitely a positive that,
Yes.
there's oftentimes things we can learn from you guys and what you guys did there. So, yeah, great questions.
And to
Oh,
buttress the fact that you guys went to dental school, we know you went to dental school for 4 years, and but the key thing when you come in for an interview is the personality, is the
mhm.
leadership. Because you went to school, you've been taught how to get a crown done, how to do a filling. Okay, we can improve on that, but personality is key.
Yes, absolutely. So before we get into tips, we've got a couple more questions. So, where's this? Yep. So, first question really being, can associates work more days in order to achieve greater production to receive the bonus and DSOs? Yeah, absolutely. Especially if you're open. I know I talk with a lot of new graduates who want to work 5 days a week. Some of you guys are crazy, want to work 6 days a week. And we want to support you in that. So typically, I know we've found that a lot of our ops partners are willing to add those days. And if you can't add it at your practice, they may offer it at a different practice nearby. So yeah, absolutely. Um, Student visas. Yep. So we do offer H-1B TN sponsorships. We also offer green cards, typically after your first year with us, but we definitely do work with sponsorships. With Heartland specifically, we usually have a deadline to have you signed by mid-February. So if that is important to you, please get in touch with your respective recruiter towards the end of this year to start those conversations for sure. When it comes to credentialing during onboarding, on average, how long does the process take? I would say most insurances, you're probably 85 to 90% of the way completely credentialed by the first 60 days, and then totally done by 90, I would say at the latest. Um, yes, like we mentioned, we do sponsor H-1B TN. The biggest tip I have is to get with a recruiter sooner rather than later. That's
Hmm.
the biggest thing. Yeah,
I got my green card through Heartland, so
proof, proof. Um, once I visit about the production. Yes. So when you're on site asking for, there's a lot of, it depends on what company that they're part of, but usually through any of their software, if it's Dentrix, EagleSoft, they can pull those production numbers for you. That's all held in that database. So even if they don't have additional reporting, they should be able to pull those metrics for you that you might have questions about. Yep. So how are we going to judge the skills of an international dentist through working interviews or resumes? So yeah, I mean, we don't do clinical working interviews. So it's the same way that we would evaluate a doctor, like a new grad. Sometimes the doctors on site will want to sit and look at x-rays with you just to evaluate, like, would we approach situations the same way? Sometimes some regions will have you meet with mentor doctors so that you guys can talk through philosophy of care and things like that. Um, that's what's pretty typical. Can a doctor choose which procedures they want to perform? For example, only surgeries or just endo, if that's what they prefer to focus on? Yeah, I mean, we have doctors who really get a little almost subspecialty in our model. They're still general dentists, but man, they are doing surgery all day, every day, and that's all that they do. So I can't speak for all models, but I know we definitely will even employ doctors who are general dentists who maybe love endo and they just come in a couple days a month and just do endo. So can you choose how many days you work? So this would be in partnership with operations to figure out what the practice needs to, because it's got to be a win-win. However, if maybe you want to work 5 days and that practice is looking for three, we're always going to try to figure out how to give you those 2 extra days. Can we work 4 10s instead of 5 8s? Again, that would be operations, really partnering with them to seeing if that would be a fit for that practice. We have doctors who work 3 10s. We have doctors who work 4 8s. We have doctors who love taking lunches, who don't ever want to take a lunch. At least in our model, it gets very provider specific in what you're looking for.
hmm
Support systems for internationally trained dentists. I know we have a lot of company groups. So we have like a women in dentistry, and we have like different new grads, international groups where you can kind of collaborate with other doctors who might be in a similar situation for you, but you would still be eligible to do the same doctor leader track in our model
Mhm.
that we offer to all of our doctors. So that is that doctor leader track in the CE is regardless of experience. That's open for everybody. Um, to who do we need to contact and when if we finish school by August 2027? So I know, and most DSOs, most private practices, we're always willing to look ahead and see if we can go ahead and sign you. A lot of it's about your comfort. If you say, I know I want Heartland, or I know I want whatever the company may be, we at least for things like our de novos, our new build practices, we are planning those up to 3 years out. So we typically know if you're graduating in August of 2027 and you want to know what's coming to that area, we can tell you what those offices will be. You're comfortable signing a contract this early, we're happy to discuss that, or at least let you know what's coming to the area. So again, I would just get in touch with the recruiter for that area. And
Like
if
I
any of
said,
those,
I think my niece, she got her contract last week and she finishes 2027.
Mhm.
You know, and she had been in talk with us for, I mean, with Heartland for a year and a half.
Yeah. When the patient signs the treatment plan and then a financial agreement, can the dentist save a copy of the agreement as a reference to track? Yeah, I would say there's probably also easier ways to track production for sure too. Most offices should be able to provide you with some kind of reporting. I know I always joke that we track everything. If you want it down to like what procedure, what month, case
Yeah.
acceptance, all those, we have everything. So most offices should be able to provide you with that. Is what we charge to the patient varied based on if the treatment was done by a general dentist or a specialist? Yep. So it's typically based on the provider who does the procedure and who they're credentialed with. So, regardless, so if you are a general dentist and you do a surgical extraction, you're only going to be able to charge out what fees you're contracted with for that office. If a surgeon does the same extraction, but they are a specialist, they often are able to charge out higher fees. 1099 versus W-2. So really 1099 versus W-2. So 1099 is an independent contractor. I know that we won't personally put general dentists on 1099s, but there are private practices who will, other groups. So that is, with a 1099, you're not a true employee. So you're not getting a lot of the benefits of whatever group that you're a part of. Whereas a W-2, you are an employee. So you're going to get access to all of the medical benefits, all of those types of things. You typically, I know at least in our structure, if you're on a 1099, you don't have the ability to quarterly bonus, to own stock, things like that. So you miss out on quite a bit versus the W-2 where, you get all of those benefits, and then the taxes are different per type of employment. With regards to signing bonuses, that is typically based on area. I wouldn't say that that's guaranteed, especially in an area where we have a lot of traffic. So places like Tampa, Orlando, Dallas, Chicago, places like that, that we are really heavily saturated. That's where you're really, I think, going to have to evaluate the things you really, 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 really want and have to have versus the non-negotiables of the company where you may not get everything. So I would definitely figure out what's important to you. Typically, more rural areas, you'll be able to negotiate sign-on bonuses a little bit more easily. That's what I would say. Typically, I would look at asking like what the payback is in the event that you don't finish the contract terms. Do you pay back in full? Do you pay back a prorated amount? Things like that. Um, so I know we're getting close on time, so I'll go through a couple more points on the slide and then I'll hop back into some questions. But in terms of just some overall tips when it comes to what to negotiate and things. So one, I would figure out your priorities. Like what are the things that you say above all else, I have to have this in a job, whether it's mentorship, whether it really is compensation, whether it really is location. Like, what are the things that you say, like, I have to have this? And then what are the things you're willing to flex on? Be sure to ask questions. And I will say, and I think any recruiter would say this, like, we are here to be your advocates. Yes, we work for Heartland, or I work for Heartland, but my goal is to get you what you're looking for, and to find balance between what you're asking and what Ops is looking for. So how do we meet in the middle to find what's best for you and what you're looking for and what those non-negotiables are, and then what's going to meet the needs of their practice. Ask for what you want and what you need. So the worst anybody can say is no, we can't do that. But you don't know if you don't ask. So don't be scared to ask. And then also understand what their non-negotiables are. So what are the things that they absolutely need? Because this is about it being a mutual fit. So we want it to be a fit for you, but it also has to be a fit for, what you're looking for. And there will be certain things in any contract that are not negotiable. So it's good to know what those things are upfront. And then again, like, I can't reiterate enough, you won't typically get everything you're looking for. Every once in a while, we get somebody who, man, we can just give them the sun, moon, and the stars, but sometimes it just doesn't happen. So really figure out what those top 3 things are, and then really hold true to those during your interview process, so that we can try to really advocate for at least getting you those most important things. And then if it just doesn't feel right, don't force it. So I can't tell you how many people that we've not been the right fit for somebody their first, year right out of school. Maybe there's something they're looking for. Maybe we don't have a location. Maybe we don't have, whatever it might be. And they circle back around a year later. And then it's right time, right place, right opportunity. I recently worked with a candidate for almost 2 years. We did 1,000,001 interviews and kept moving people around, and we could never get him the right spot. And then, I'll be honest, he ended up with probably the best location that we offered to him during that 2-year time, because it was just right time, right timing for him. He waited out for the things that were important to him, and they came around. So definitely don't take something if you're not really, if you're getting a weird vibe or it's not,
Mm-hmm.
what you're looking for. Definitely trust that. I will. So here is just an overview. So for Heartland, we do follow a super GP model. So you guys are encouraged and supported to do whatever procedures you feel comfortable to do. We do not have specialty on site typically. There are some pockets where you'll find a little bit of that, but we support over 3,000 doctors at this point in over 39 states. We are the largest DSO in the United States. We're coming up on 2,000 practices, with Florida and Texas being our 2 biggest supported states. So if you guys are interested in joining Heartland, we would definitely be happy to help and answer additional questions or put you in touch with. I know a couple people have asked for recruiters. So happy to help with that too. As we're kind of getting through the end here, I'll hit on a couple of these. So when it's time to do the green card process, who pays for the process, and who helps with attorneys. So if you sign, with us, again, I can't speak to every group, but with us, we do have an entire department that handles the entire process. And that is an expense that we incur. So, and that includes the attorney, the green card process, all of those different things. So we do take care of all the paperwork and the financial aspect of that. Graduating in June. If I get a contract signed this year, do you provide any training while being in school before starting working next year? So typically, so there's certain CEs that, of course, you can't have linked to your to you until you have a license. I know a lot of regions will welcome you to like our doctor dinners so that you can at least start to meet other doctors in the area. They may invite you to some of the study clubs, things like that. But we do try to wait for any formal training, like your actual CE pathways with us, until you're licensed. What are the benefits of working with Heartland rather than open your private practice directly after graduating? I think the biggest one is if it's important, I think one is figuring out what's important to you about opening your own practice.
Mhm.
If you want the experience, I would first recognize that or challenge you to think through, do you really know what that's going to entail from a business standpoint, from a training standpoint, from a facility standpoint? If your toilet is overflowing, who's fixing that? If it happens after your last patient at 6 o'clock at night. If your business team, somebody quits or messes up your insurance verification, who's going to get them trained? Do you know how much a dental chair costs? Do you know how much it costs to get it fixed? So with any DSO that opens new practices, if you want to figure out if that's really for you, I would encourage you to be a part of our or any, DSO's de novo process. You'll learn a lot about running a business. You'll learn a lot about tips, tricks, things like that to getting an office up and going. But you still have support. You still have people who can take it over. If you decide 6 months in, like, oh, wow, this is a lot, nobody's coming to save you if you're by yourself. But if you're in a de novo situation with us, you're having constant, monthly monitoring calls. They're evaluating your marketing. They're giving recommendations of how to get more new patients. And if you get to a point where you say, like, oh my gosh, this is a lot, I just want to go home and relax, you can. We have a lot of doctors who will join us. They'll learn a lot, they'll grow a lot clinically, and then they will. But I would say right out of school, there are so many other focuses that adding business leadership, team selection, team development on top of that, I think recognizing the stress that puts on you for sure. And I don't know, there's probably so much more that could probably be a whole call, honestly, but those would just be some things I would think that I would include.
Brittany,
So
we're coming to the top of the hour, but there's a ton of questions that they have
I
for
see
you.
that.
So I do want to take just a few more if
yeah,
you have the time, you
yeah,
and Dr. Ajala,
Yeah.
if you can answer. And then to all of you who are sending questions, Brittany, we could send these questions to you and you can
yeah,
respond. And then when we do the follow-up, we can give them the answers to the follow-up email
yeah,
about the saved webinar.
yeah. No, that would be awesome.
Okay.
Um, let's see. With regards to the doctor's schedule, so with us, we personally have systems in place to try to make sure patients leave with 2 appointments so that they're leaving with their next recare as well as their treatment scheduled. So we have systems in place. And again, that's something we can teach, something we can coach, something we can monitor. And then we do have protocols for when the schedule's empty. We actually have systems of what to do when the schedule is empty, whether it's for the doctor or for the hygiene. Let's see.
Let's take
Um,
two more.
yeah. So if you get offered a contract, is there a possibility that it will get revoked if negotiations go back and forth more than 2 times? What's a reasonable amount of negotiating? That's a great question. No. Again, I can't speak for everybody with us. No, we want you to ask all the questions that you need to feel comfortable. But I will say at a certain point too, if you're finding that you have a lot of questions, I would schedule time with the recruiter or with the ops team, whoever you're working with that particular group. Sometimes things are better explained verbally. So if you're having a lot of questions, I would definitely take the time to not just exchange text, email, things like that, set up a call so you guys can discuss in detail. But don't be afraid to ask those questions. I know typically we try to get answers from candidates within like 5 to 7 business days, but as long as you're communicating, then we're open with more time. And then some of these super technical will definitely get you guys the answers to those. Um,
Who gets the winning last question
I
answer?
know I'm trying to figure out which one might be the most helpful. So with regards to base salary, so I'll touch on that just since that is such a big part of our model. Base salary will vary based on the area. So again, if a higher base salary is more important to you, I would consider some of the more rural options. We are super supportive of doctors transferring. We love to get doctors closer to home. in areas of interest, but it may be worth working in a more rural market for a little bit if a sign-on bonus or higher compensation package is important to you. For our doctors, they are paid on a regular biweekly pay schedule. So they get a paycheck every 2 weeks, probably like most of you guys are accustomed to in the jobs that you've had, but the actual amount will vary based on location and the practice that you guys narrow down. So that's
So
what we got.
thank you. Thank you both. This has been a very informative, and I know all your questions didn't get answered live, but we will make sure your questions do get answered. So on behalf of ASDA, I can't thank Brittany and Dr. Ajala enough, as well as Heartland for sponsoring this webinar. And more information can be found about Heartland Dental. So you can scan the QR code that you see on the screen right now. They are willing to help you and go deeper in some of these questions that you're asking. So Brittany and her team is excited to be able to talk to you all. So please make sure that you reach out. If you'd like to view this webinar again, it will be posted in 1 week on ASDA's YouTube channel, and it'll also be saved to our webinar directory at asdanet.org, and that's under the programs and events webinars. So what we'll do is we'll make sure that we'll send you a reminder when the webinar is available. And then we'll also send any additional information that Brittany or Dr. Ajala would like us to share with you. We'll make sure that you get it. So thank you guys for joining us this evening. We do appreciate it. You have a wonderful night. And thank you both.
You're welcome. You're
Thank you
welcome.
guys.
Thank you.
Good night, everyone.